Hey y'all, so this is on a trauma patient that I had come in a couple days ago. We're mainly focused on the chest x-ray, but we can discuss other things, of course. So this was a mid-50s male that was involved in MBA rollover, ejected, found face down on the ground. EMS brought him to us with one IV, and that was it. This is a small, very tiny rural hospital. I know some people have big ideas about rural hospitals, but this is the type of rural hospital where you are lucky because you do have two RNs on, and EMS stays to help for extra hands, which is appreciated. So anyway, this patient came in hypotensive. Blood pressure was in the low to mid 70s, tachycardic. His GCS was 11. He was pretty much out of control, thrashing about, saying, odd things, etc. So my first action was to pop on the ultrasound and do an EFAST, which I found a left pneumothorax and probable bleeding around the left abdomen, spleen area. It was difficult to see because he had a large swelling along the left side, but the right side was clear, pelvic scan was clear, heart was clear. So it was just the left pneumo and probable bleeding into his abdomen around the spleen. I then put a chest tube in the left side, which you can see we didn't get a chest x-ray, obviously, until after I got him stabilized. Put a chest tube in, I intubated him first, and then put a chest tube in afterwards. And his SATs and blood pressure didn't really improve, heart rate didn't really improve. And when I put the chest tube in, I didn't really get much of a rush of air. I got a fair amount of blood back, 150 cc's, but no rush of air, so I don't think he had a tension pneumo. This is his first chest x-ray that I'm going to go over. And you can see that both lungs are inflated. There's no pneumo present. Let me start with the A's. Airway, you can see the trachea coming down here. And it branches right here. So this is the carina. And you can see the ET tube. It was easier on the machine, obviously, because I could blow it up. I can't really blow it up here or change the lightness, darkness. But the ET tube was right here at the carina, which was a little too low, obviously. B for bones. So if you go over the bones, you can see there's a lot going on. He has most likely a flail chest on the left. He has multiple fractures in multiple places. You can see fractures here and here and here. And it appears these are posterior ribs that are fractured. You can't really see the anterior, but you can see some more fractures lateral as well here. As well as on the right side, you can see a fracture here. And I know there's more. The second chest x-ray showed him better, which we'll go over again. So that's bones. C for cardiac silhouette. You can see the cardiac silhouette coming down, and it looks all right. Diaphragms look okay. And E for everything else, you can see there's a lot of contusion going on, especially on the left side. But there are vascular markings all the way out to the periphery. So the lung is re-expanded with this chest tube. With the ultrasound, I was able to find a lung point. But obviously with the mechanism of injury, it's pretty obvious that it was a pneumothorax. I don't see anything else on this particular chest x-ray, and I'll pop up the other one and go over it as well. All right, here's a second chest x-ray. So you can see, starting with A, here's the airway coming down. And it looks like this is the carina right there. And you can see the ET tube now. I pulled it back 3 centimeters, and here's the end of the ET tube. So it's about perfect placement now. And you can see the addition of a This is an OG tube that's coming down here, crosses a midline, and we didn't get down far enough to actually get it, but I'm comfortable that it's in the right place. Again, the chest tube right here. I think I forgot to mark that on the first chest x-ray. I'll go back and mark it real quick. And so let's look at the bones again on this one. You can see a fracture here, fracture here, fracture here. So counting the ribs, this is first rib, second rib, third, fourth, looks like fifth, sixth, seventh there. Did I count that right? First, second, third, looks like fourth, fifth, yep, sixth, seventh, yep. So those are definitely fractured. I can't really see any others there. But again, chest x-rays aren't the best for picking up fractures anyway. And of course on the left, we still have the multiple fractures over there, displaced ribs. So this guy's in a world of hurt. So the SATs after I intubate him didn't really change a whole heck of a lot. And but once I withdrew this ET tube, the SATs popped up in the low to mid 90s. So it's obviously what he needed. The chest x-ray continued putting out a little bit of blood. The blood pressure and heart rate didn't really improve, so I gave a unit of O-neg and a unit of O-pos blood, and that seemed to fix him. He got no crystalloid at all, and 2 units of blood, and EMS, we air-evac'd him to the larger hospital, which is about 60 miles down the road. And I haven't heard how he's doing. But anyway, hope this helps on chest x-rays. Let me know either message or on comments. Happy to discuss, and I appreciate your time.